It's surprising how erectile dysfunction may anticipate by up to 10 years a major cardiovascular events. Hello and welcome everybody. My name is Giangiacomo Ollandini. I'm a urology consultant and I work in Milton Keynes and in London. Today, I want to talk with you about a problem that is very, very frequently found in men of all ages, really, and is the erectile dysfunction. It's very simple to define erectile dysfunction as the inability of having a valid erection. It can be the inability of achieving an erection, the inability of maintaining an erection, or both. So going just briefly into the anatomy of the penis is simply a bunch of blood vessels. Clearly, is not a muscle as many think, because otherwise the exercise would increase the size, and that is not happening. But it's a bunch of blood vessels that contains the smallest arteries of the body, and that is fundamental because it can flag some problem that is happening at systemic level. That means in the rest of the body. And you see first in the penis because the arteries are the smallest ones. These blood vessels are contained by a membrane that is called tunica albuginea, that is thick and inextensible, and that is in charge of giving the stiffness when these blood vessels are inundated of blood. There is a system of containment of the blood that avoids the leakage of blood out of the penis too soon. So that what happens when there is a stimulus, arousal, or sexual stimulation, blood is flooding the penis that enlarges, and this distension provokes the stiffness, and the blood is contained by this system. There are many things that can go wrong in this very complex mechanism. For example, the blood might not be well contained by this mechanism and might leak out. That is called actually the venous leak, and that can be a problem one is born with for some form of anatomical abnormalities. Or it can be induced by an inappropriate activation of the system that is in charge of having the blood out of the penis. When can this happen? Well, it's quite a common cause as well. This mechanism is activated by adrenaline and noradrenaline. The stress hormones produced by the adrenal glands in reaction to a stressor or to fear, to anger. It's not surprising. The evolution must have favored the human that in front of a jaguar in the middle of the jungle, instead of having an erection, had the blood somewhere else at the muscles in order to fight or fly. So that we have just defined what is called psychogenic erectile dysfunction. And it's a common name also, performance anxiety. So it's nothing far away in the clouds. It's pretty much in the body, even if sometimes it's defined as something, oh, don't worry, it's only in your mind. But the mind is part of us and talks with the body with the very same language as everything else. In this case, adrenaline, noradrenaline, and their physical effects. What happens when instead the blood does not arrive well enough inside the penis? Well, in that case, we have the arteriogenic erectile dysfunction. That is very common in the cohort of population that have a number of different cardiovascular risk factors. For example, diabetes, high cholesterol, high blood pressure, and a sedentary lifestyle, and of course, the cigarette smoke. The reason for this to happen is the damage to the blood vessels that are unable to comply with the request of the body of expansion. The increased flow does not happen and the penis does not get hard. When I see patients in clinic that arrive with the problem of erectile dysfunction, I always tell them that my second priority is to help them with erection. And the first priority is to make sure that they live long enough to be able to enjoy them. In fact, it's surprising how erectile dysfunction may anticipate by up to 10 years a major cardiovascular events. And it's also incredible to notice that patients that have had a major cardiovascular event can recall having suffered earlier from erectile dysfunction. Well, the truth is that maybe some of them, if they had gone in time to the doctor for a checkup, and if they had engaged in changes of lifestyle, they might have felt better and avoided it. So that is the major take-home message for prevention of cardiovascular disease. If you have a problem with erectile dysfunction, don't think it's age, don't think it is something that is not relevant. It may be very relevant and it may save your life. Go to the doctor, have a chat, blood test, blood pressure, and see how it goes. Treatment available for erectile dysfunction, I like to classify them in 3 layers. In the first layer, there is the first approach to erectile dysfunction, tablets. They are called PDE5 inhibitors and is a class of medication that include the famous Viagra or Sildenafil, Cialis or Tadalafil, Levitra or Vardenafil, and Spedra or Avanafil. They work in the same way, with some little difference between one and another, and they enhance the natural pathway, arousal, higher inflow, erection, making it easier. So it's not an artificial signal, it's not an inappropriate erection. They simply make the mechanism faster and easier for the body. On this regard, it's important to remind that it is a false myth believing that this class of medication are a harm for the heart. What is true is that they cannot be given in association with certain medicines given to patients that have had a severe heart problem. But apart from this interaction, they are proven to be heart protective and not harmful. Still at level number 1, we find the external shockwave therapy. This is a rather new approach to regenerative medicine, where the mechanical stimulation offered by the treatment of shock waves, it's like a sort of very focused slap, will promote the rejuvenation of the vascular tissue. And actually it is endorsed as the only curative treatment for the vascular erectile dysfunction. Up one level and we have intracavernosal injection. That means injection inside the penis of a substance that will induce in that moment an erection. Not quite in that moment, 10 minutes later, but that means it does not rely on being in the right mood, of being with the right person, of being sexually stimulated. The erection induced by injection happens just after the injection. It's important to remember that it can be dangerous to inject themselves if you don't know how to do it, if you don't know what to do if things go wrong. So please, if you need to be trained in injective therapy, make sure that you contact a professional that will be able to train you about it. I have trained thousands of patients and doctors in how to do it safely and effectively, but still there are incidents where the inappropriate use of intracavernosal injection leads to the loss of the organ entirely. At the highest level of treatment, there is the surgery with the penile implants that can be a single component or inflatable ones in 3 components that are reserved when everything else have failed. There is one more indication for the shockwave therapy, that is the salvage treatment. When nothing has worked or nothing works anymore, in 60% of cases, doing a prolonged cycle of shockwave therapy has been proven effective to recover erection. So it's quite worth thinking about it. Then there is a number of newer treatments that are not yet endorsed by clinical guidelines, and is worth briefly mentioning. There is the PRP shot, or platelet-rich plasma shot. There is the injection of botulinum toxin, and a number of other technologies that are going to be tested. But still, these are not yet proven, so they should be very carefully selected and used with extreme caution. But again, take-home message is, if there is a problem of erection, let's talk with the doctor as soon as possible.